WWE Hall of Famer Scott Hall, or Razor Ramon, as wrestling fans knew him, passed away due to complications from a relatively low-risk hip replacement surgery last week. What gives?
Razor Ramon! How about this?
For many years, Scott Hall played the badass role both inside and outside the ring, living life in the fast lane seemingly beyond the grasp of injury. But last week, at 63 years old, he fell and broke his hip, an injury for which he would have to undergo reparative surgery. On March 1st, wrestling legend Jerry Jarrett quoted via 411 Mania, "Just got off the phone with my friend Scott Hall. He fell and broke his hip and he's in the hospital. Prayers will help him recover." Apparently, due to blood clots after the surgery, Hall suffered 3 heart attacks. He was put on life support before passing away in the presence of his loved ones.
You know, I don't want to die, but like I'm not afraid to. What's left, man? What do you do when they quit chanting your name?
Razor Ramon!
Now, typically, a replacement is a low-risk operation with a risk of complications at about 1%. Normally, we approach the hip through one of 3 different incisions and enter the joint capsule. We remove the arthritic head and neck from the femur and replace them with a titanium stem that is implanted into the shaft of the femur and a head that articulates with the socket. On the acetabular or socket side, we ream out the degenerative cartilage and then insert a metal shell and a plastic liner into the socket. Patients are encouraged to weight bear as tolerated immediately after surgery, and with appropriate active rehabilitation, most people recover within 3 months and are able to return to most of their regular non-impact activities. So why did this happen to Hall? And more importantly, why now? Well, unfortunately, for a man touted by many as one of the greatest wrestlers of our time, this was the culmination of a long list of health troubles. And the story begins long before his recent operation in 2022. This wasn't even his first operation of this type. In 2013, Hall underwent another hip replacement surgery funded by fans on Indiegogo. This post is from the original campaign organized by Diamond Dallas Page, who played a loving, supportive role in Hall's life. We didn't know just how broken Scott's body was. At the young age of 54, Scott has had a pacemaker and defibrillator implanted for his heart, and he can barely walk due to extreme arthritis in his hip. As early as 2013, a lifetime of pushing his body to the limits was beginning to take its toll. Scott Hall was open about his steroid use, which helped him fill out his imposing 6'7" frame from a young age, as well as his battles with alcoholism and PTSD. All factors that may have contributed to his declining health. At the time, Scott was 40 days sober for the first time in his life, facing the sobering reality of a failing heart, which would require the assistance of a pacemaker and defibrillator to keep him alive. A pacemaker is an implantable device that is used to establish the normal beating rhythm of the heart. Normally, heart rhythm is automatically produced by natural pacemaker cells within the heart that send out a synchronous signal to the cells of the heart telling them when to contract. If these cells are damaged or the conduction of the signals is impaired, then the heart becomes incapable of pumping in a coordinated manner at an appropriate rate. A pacemaker is used to restore this ability. A defibrillator is an implantable device that is used to detect and override abnormal heart rhythms that might lead to a cardiac arrest. The defibrillator delivers an electrical current to the heart, which depolarizes the heart and stops the arrhythmia. Basically, you short circuit the abnormal rhythm, subsequently allowing the normal rhythm to take over and synchronize the heart muscles. These devices can be separate devices that are implanted into the heart individually, or they may be combined into a single device that provides both functions. As Scott had a combined device implanted, his heart likely had suffered damage which resulted in abnormal pacing and was relatively susceptible to non-productive heart arrhythmias. At the young age of 54, this was somewhat unusual, and it speaks to the extent of damage that was present in his heart at the time. The replacement of his severely arthritic hip was of secondary importance, though it would not keep him alive directly, like the previously mentioned pacemaker and defibrillator. It would allow enough movement to exercise regularly and rehabilitate his heart. The procedure for an arthritic hip replacement is different from a hip replacement due to a fracture. With a normal hip replacement, both sides of the joint are replaced as was discussed earlier. This is a total hip arthroplasty where head, neck, and socket are all replaced. When a hip replacement is performed for a hip fracture, typically only the femoral side of the joint is replaced. This is called a hemiarthroplasty, where the head and neck are replaced, but the native socket is left untouched. Now, to be clear, it has not been determined whether Hall fell and suffered a hip fracture to his native hip that had not yet been replaced, or whether he had fallen and suffered a fracture around the hip implant that was already in place. Were the former the case, Hall would receive a hemiarthroplasty. However, were the latter the case, Hall would require a revision of the prosthesis that had been previously implanted in what is called a revision arthroplasty. In that procedure, the implant is assessed for stability and is either left in place, the fracture fixed, and the implant supported with additional surgical implants and bone graft if stable, or is removed and replaced with a more robust implant and bone graft if unstable. Either way, this is a bigger procedure than when the initial prostheses were implanted and carries with it an increased risk of complications. Frequently, those for whom this procedure is required are debilitated and have comorbidities that make their perioperative risk profile unfavorable. With all of the medical problems that Hall suffered, he was within this cohort of at-risk patients. Now, health is at once a very simple concept and a complex intertwining of myriad factors, some of which are more difficult to measure than others. Performance-enhancing drugs are known to have an adverse effect on the heart. Since Hall's cause of death was heart attack, we have to also consider those effects. A 2017 study demonstrates that anabolic androgenic steroid usage can narrow the coronary arteries and impair left ventricular function due to unfavorable enlargement and thickening of the left ventricle, which loses its diastolic properties with the mass increase.
Damn it, Doc, you gotta keep still if you wanna look like me.
That's a freaking mouthful. This basically means that as the heart enlarges and becomes more muscular, it loses its ability to relax and fill with blood appropriately.
Yeah, sure, I'm yoked out of my goddamn mind, but it's just not worth it, man. It's just not worth it.
Together, the narrowed coronary arteries and the inadequate heart filling can reduce the supply of oxygenated blood both to the heart and from the heart to the arteries. The same study showed that the use of anabolic androgenic steroids is also associated with atherosclerotic plaque, which further compromises heart pumping. The heart is a muscle.
Damn right I am.
Similar to other muscles in the body. It receives oxygenated blood through the coronary arteries, which supply the heart muscles and provide them with the fuel that powers their contractions. As the heart activity increases in conjunction with an increase in overall activity, the demand for oxygenated blood likewise increases. Normally, the coronary arteries would expand in response to allow more oxygenated blood to be delivered to the cardiac muscles. However, if the coronary arteries are narrowed, then less blood is available even when they are temporarily expanded. Likewise, if there is atherosclerotic plaque that is partially or fully occluding one or more of the coronary arteries, less, or in some cases, no blood is available to meet the increased demand of the cardiac muscles. If the cardiac muscles cannot be supplied with oxygenated blood, their cells die in whatever distribution is supplied by the coronary arteries, unable to meet the required demand. If enough cells die, the heart is rendered unable to function properly and a cardiac arrest or a non-productive cardiac arrhythmia occurs. Neither of these is compatible with life, and in the event that life-sustaining treatment is not immediately available, that is all that she wrote. Long-term alcoholism may have also contributed to Hall's untimely passing.
I come from a long line of hard-drinking rednecks. My dad was an alcoholic. My mother was an alcoholic, but my grandparents were alcoholics.
This was a man with a difficult past who used alcohol to numb the pain of some decidedly haunting experiences.
And he was reaching for the gun, so I reached for it too. We wrestled around with the gun. I took it and shot him in the head.
He fought tooth and nail to free himself from the clutches of his traumatic memories and substance abuse, sometimes with more success than others. Excessive drinking over a long period of time can lead to ongoing increased heart rate, high blood pressure, weakened heart muscle, and irregular heartbeat, all of which can increase the risk of alcohol-caused heart attack and stroke. An increased heart rate requires an increased supply of oxygenated blood to fuel the working cardiac muscles. The heart has to work harder to supply itself. In addition, as the heart rate increases, the efficiency of the pump decreases, leaving the heart less able to effectively supply blood to the organs of the body. High blood pressure creates resistance to the blood that is exiting the heart. The higher the pressure of the standing blood outside of the heart, the harder the heart has to pump to push blood out of the heart and around the body.
I have an idea. Why don't you cut me a break?
In addition, the higher standing pressure puts pressure on the vessels within the brain, increasing the likelihood of stroke. A weakened heart simply doesn't have the strength to produce enough pressure to pump blood around the body with any real efficiency. And finally, an irregular heartbeat causes a lack of coordination between the contracting chambers of the heart, leading to ineffective pumping of the heart. An ineffective pump, in turn, cannot supply oxygenated blood to the brain or any of the other organs. All of these conditions result in abnormal stress on the heart, which increases the chances of myocardial infarction or stroke. All around, bad news. In combination with cardiac changes precipitated by a lifetime of alcohol dependency, and this doesn't set a scene for robust day-to-day function. In fact, these conditions would leave Hall in a state of frailty that normally would be unusual for a man of Hall's age and stature. Hall may also have been at risk of alcoholic cardiomyopathy, a condition where your heart changes shape because of the long-term heavy alcohol use. The changes to your heart shape cause long-term damage, leading to heart failure and severe problems. It seems that our list of comorbidities is increasing ominously, but we still have the effect of alcohol abuse on the liver to consider. The liver is an organ that filters and removes fat-soluble toxins or chemicals that are present in the body. It plays a role in the metabolism of alcohol using an enzyme called alcohol dehydrogenase, breaking alcohol down into byproducts that can be easily excreted from the body. Alcohol consumption results in the death of some of the cells used to filter the alcohol. Normally, the liver is quite resilient and it can regenerate these cells. However, prolonged alcohol abuse will eventually prevent the liver's ability to regenerate. Damage will accumulate over time, leading to reduced liver function and scarring of liver tissue. Now, the liver plays a key role in blood clotting or coagulation, being involved in several types of bleeding control. It is the site of synthesis of nearly all the coagulation factors and their inhibitors. Damage to the liver is commonly associated with impaired coagulation. The liver is an essential organ that is involved with the clotting process, and liver diseases are frequently associated with coagulation disorders of various types. The associated bleeding tendency leads to increased risk of morbidity and mortality in patients with liver disease undergoing diagnostic or therapeutic invasive procedures, of which a hip arthroplasty is one. During an orthopedic procedure like a primary total hip arthroplasty, the anticipated blood loss can range from 100 mils to 400 milliliters, or approximately 1/5 to 4/5 of a pint, or half to 2 cups. With an estimated circulating volume of 5 to 6 liters, or 1.6 gallons, this amount is an insignificant amount overall. But with a revision arthroplasty, the surgical time increases as a result of the difficulty of the procedure. As surgical time increases, so too does blood loss. With revision arthroplasty, it is not uncommon for there to be 800 milliliters to 1 liter or more of blood loss during the surgery. The coagulation disorders that are commonly associated with liver disease would make the blood loss difficult to manage and potentially much, much worse, which in turn would increase the stress on his already frail heart.
We talked about this, man.
Lower circulating blood volume means increased heart rate, which means increased requirement for oxygenated blood in the coronary arteries, which means, did I mention before that with his steroid-abused heart, that's a problem? Now we are beginning to get the picture. There are a lot of factors that may have contributed to Scott Hall's heart attacks after his surgery. Any major surgical procedure is largely an insult to the body. From the body's perspective, it is an insult that elicits a stress response from the body. Interventional cardiologist Dr. Atal Mather makes this clear when he says, any major surgical procedure performed under general anesthesia triggers the adrenergic system of the body, which puts stress on the cardiovascular system. This is by increasing heart rate, blood pressure, and clotting tendency in the blood. Persons with pre-existing heart disease may at times not be able to withstand this insult and develop a heart attack during or soon after the surgery. This risk is further enhanced by stoppage of blood-thinning medications to reduce the bleeding from the wound. So, under normal circumstances, an otherwise healthy individual has a low risk of complication from a hip replacement surgery. But, as we have seen with Scott Hall, there are many factors that can elevate that risk. It is sad to see him go, and he will be remembered by many as a legendary wrestler who lived his life on his own terms. Who says we can't love a villain? Hard work pays off, dreams come true. Bad times don't last, but bad guys do. Let me know what you'd like me to cover next. As always, that's been a word from Dr. Chris, not your everyday ortho.